Thank you, Anne-Laure. For the next presentation, I'm going to call Isabelle. Dr. Nyon Marmurier could not make it, so she has recorded her talk, and she is going to tell us how we should use vaccination for IBD.
I'm sorry I can't be with you. With patients with inflammatory diseases, the vaccination, full vaccination coverage is 45%, and it's increased when there is a dedicated consultation by the GP or the specialist. So the message is that vaccination is everybody's business. It's not only the concern of general practitioners. The prevalence of infection with pneumococci is higher in our patients, where the vaccination rate was only 10% in these people at risk. Now, why are people reluctant to go for vaccination? It's either because the topic was not discussed by the physician, the vaccination record was lost. It's only 7% who are anti-vaccination. Can be a poor knowledge of the history of the patient on the side of the GP, with no knowledge of the guidelines and recommendation for patients with immunosuppressive disease, and some patients do not consider that it is their business. But there is a high infectious risk in IBD patients related to their treatment because they have an inflammatory disease. But this infectious risk may be low in some instances when you use budesonide at 6 milligrams. And if you have a high dose of corticoid drugs, some of the drugs are indolutinate. For doliginate, it's a bit particular because the prevalence goes up with a digestive disease. The risk varies. It can be viral or bacterial. And I would put the emphasis on viral risk in patients with tofacitinib and another drug. No, IBD is a risk factor for pneumococci infections. So it means that you would have to put the emphasis on this vaccination. This has led to an upgrading of the ECHO guidelines. They put quite a lot of emphasis on pneumococcal vaccination for all patients with immunosuppressive disease, to have influenza vaccination, and stick to their country guidelines and have HPV update. Now, for the French guidelines and recommendations, you have two recommendations for those authorized vaccines that are inactivated for DTP-CoC, as unlike to the general recommendation, it's every 10 years. And now, for pneumococcus, there's a particular case, it has changed. It's a single shot, same as the general population. Of influenza, it was one annual injection. HPV, it has to be given with a second boost up to the age of 26. When you're over 15, it's three doses and not 2 doses. No, live vaccines are not recommended. Varicella, if needed, beware of oral rotavirus, because for those women who've had immunosuppressive drugs during their pregnancy, there's a risk for the baby, and that's when the oral rotavirus is given. No, you have to anticipate. So it's the rule of 3. When you have a live vaccine, it's stopping 3 months before treatment and 3 weeks after you resume. There is quite a high risk of relapse. You have to discuss it as soon as the diagnosis is made, and not for all the others. It can be done at any time. Now, there are some updates for 2024-2025 from the French health authorities for pneumococcus. To start with, instead of the Prevnar 13 followed by Pneumo 23, no, it's a single dose Prevnar 20. So either you have a single dose which was given of Pneumovax, so it's only one dose at 1 year, but you've had a complete vaccination, it's a boost at 5 years, and then it's over. Second case, VRS, depending. As according to the French health authorities, it is recommended in people over 75 or over 65 with a respiratory or cardiac disease. For the over 60 years, it's RXV and Abrysvo, which are not covered by the French health security system. There might be, at the end of the summer, new guidelines, which will be published. Against herpes zoster or shingles, it's Zotavax. It is recommended for the prevention of herpes zosters and prevention of post-zoster neural disease in all patients over 50, 2 doses with a 2-month time difference. Now, when you have such an episode, the question is, when should the vaccine be repeated or boosted? It is recommended to wait for some time if there's no relapse for meningococcus. March 2025, very recent guidelines. It was only for children. Meningococci, it's replaced by ACWY, Nimenrix, Menquad-Fi. It's mandatory for infants and recommended for adolescents up till the age of 14. And recently, there has been a campaign of vaccination catching for the 15 to 25 years old with a single dose in order to reach herd immunity after the cases of meningitis. The second, which is the Bexsero vaccine, is mandatory for infants up till the age of 2 with a catching up campaign up till the age of 5. And this, it is reimbursed by the French health security system because there was an outbreak of meningitis in a university in Brittany. So there will probably be a need to have this updated. Now, how can things be improved? Well, through education of the patient, take the necessary time to provide a dedicated vaccination, but these dedicated consultations will increase the vaccination rate and reduce the infectious rate. I think that all the healthcare professionals should be mobilized for vaccinations because nurses, midwives, pharmacists, and physicians may provide the vaccination based on the vaccination or immunization schedule. No, these are preventable diseases. Some of the drugs we provide to our patients may be harmful. So it's not only the concern of GP, so we need to have, as soon as possible in the history of the disease, start with the vaccination, pneumococcus, HPV, hepatitis B, varicella. You have to go for serology if you have any doubt. It's a live vaccine. Same for the yellow fever. It's a single injection. There is no need for a boost. And meningococcus. With patients with immunosuppressive drugs, it's the rule of 3. That is DTP every 3 years, influenza, COVID, herpes, zoonoses, and pneumococcus. Go for education, and also if there are specific vaccinations depending on the areas where people will travel. And I think that it will improve when we use better this so-called electronic individual medical record. And I will invite you to check the Vaccination Info Service, which is pretty detailed and very well designed. Thank you for your attention. We can try and answer some of the questions if there are any. for the last 10 days, HPV vaccine is now fully reimbursed for women up to the age of 26. Finally. It was a very clear presentation. COVID was mentioned. It was mentioned every 3 months. Every 3 months, every winter.